Quality health delivery is basic and should be fundamental to hospitals or healthcare. But one essential factor worthy of note is circulation within the healthcare spaces. Welcome to Designed for Recovery, the podcast exploring the fascinating intersection of healthcare and design. We focus on crafting environments that promote healing and nurture the well being of staff while optimizing outcome for both patients and healthcare providers. I am Lowo Adeyemi, and today we are addressing a subject often overlooked yet compelling: healing spaces, the untapped power of corridor design in healthcare. If you are a healthcare investor, owner, clinician, or designer, I encourage you to pay close attention. This discussion transcends mere aesthetics. It's about enhancing return on investment, elevating patient satisfaction, improving staff efficiency, and fostering an environment conducive to healing. Let's reimagine these long, sterile hallways as vital pathways that lead to exceptional care. Imagine this scenario. A patient arrives for a critical chemotherapy session. Emotions are already running high with anxiety. Upon entering the facility, they discovered a confusing network of identical corridors, harsh fluorescent lights flickering overhead, medical equipment clustered along the pathway, and no window to provide a sense of calm. They lose precious time locating their appointments, leading to increased stress levels. This is not just a momentary inconvenience, it has significant financial implications. Research indicates that spatial disorientation can heighten patients' anxiety, delay essential treatments, and even worsen recovery times. For investors and owners, this translates to prolonged wait times, an elevated risk of readmissions, and potential damage to facilities' reputation. Let's not overlook the impact on staff. Nurses maneuvering medication carts through narrow, chaotic corridors waste valuable time dealing with obstacles rather than focusing on patient care. How often do you hear the directive, just make it functional, while crucial human element is sidelined? The reality that corridors are not mere passageways but integral caregiving spaces that influence first impressions, guide behaviors, and ultimately sway health outcomes. It is time to address these challenges head on. Now, for the thrilling announcement, making small yet strategic design changes can lead to significant improvements in performance and overall returns. Let's delve deeper into this concept by breaking it down into specific and actionable principles that you can implement effectively. By focusing on targeted adjustments, we can harness the power of design to drive meaningful results and enhance user experience. The first of this principle is accessibility, which equals efficiency. Designing corridor with a minimum width of 8 feet, that is 2.4 meter, significantly alleviates congestion, allowing for smoother navigation through healthcare facilities. By reducing the likelihood of collisions, these wider pathways can also lessen the incidence of legal disputes arising from patient falls or staff injuries. Furthermore, incorporating recessed doors minimize the potential for damage caused by wheeled gurneys and lead to decreased maintenance and repair costs over time, thereby enhancing operational efficiency. Designers should use bumper guards to shield sensitive wall areas from danger caused by equipment movement. When budget constraints are a factor, as a designer, prioritize design enhancements in high traffic zones such as emergency rooms. This improvement enhances safety and streamline patient flow, promoting better overall care. The second principle is nature and art. Research indicates that integrating views of greenery or calming art into healthcare environments can significantly reduce cortisol levels in patients, leading to improved relaxation. A more tranquil patient is easier to engage with and likely to have more positive health outcomes during treatment. A 2016 study revealed that hospitals with dedicated art programs saw an impressive 12% reduction in the average patient length of stay. This efficiency translates into a faster turnover of hospital beds and an increased capacity to serve more patients, thus enhancing institutional revenue and community health outcomes. The third principle is lighting. Transitioning from harsh fluorescent lighting to softer indirect LED alternatives can drastically mitigate discomforts such as migraines and high strain among patients and staff. The careful placement of lighting fixtures to mimic natural light can create a more inviting atmosphere that supports healing. Maximizing the entry of natural light into hospital environments not only promotes a more uplifting ambience but also leads to significant reduction in energy costs. Study shows that staff who work in well-lit area report a remarkable 12% improvement in productivity, which can enhance overall care effectiveness and staff satisfaction. And the fourth principle is flooring. Although the initial cost of installing antimicrobial carpeting may be higher than the conventional options, this investment paid dividends by effectively reducing noise complaints that can affect patient experiences. A quieter environment is associated with improved patient satisfaction, leading to fewer grievances that can detract from facilities' reputation. Quieter flooring options such as cushion tiles or specialized carpets greatly diminish interruptions during critical patient consultations. This fosters an environment that supports focused caregiving and enhances the quality of interactions between healthcare providers and patients, ultimately contributing to better healthcare outcomes. I will be back shortly. No design solution is without its unique set of challenges. It is essential to address the following key concerns thoughtfully. Infection control teams frequently express hesitance regarding the use of carpets in clinical environments due to their potential to harbor pathogens. A practical and aesthetically pleasing alternative is the incorporation of seamless vinyl flooring, which not only facilitates easier cleaning but also maximizes the risk of infection spread. To enhance comfort, consider integrating noise dampening underlays that absorb sound without compromising the sterile environment. Furthermore, the emergence of innovative antimicrobial textiles presents a breakthrough, offering material that inhibits microbial growth while still providing a soft and comfortable feel for the patient and staff alike. Many smaller clinics face significant limitation in spatial design, often lacking the room to implement standard 8-foot or 2.4-meter corridor width. To navigate these challenges, designers can employ creative solutions such as angled alcoves that double as comfortable sitting areas, effectively utilizing previously wasted spaces. Additionally, the strategic use of mirrored walls not only creates an illusion of greater space but can also enhance natural light, making the environment feel more open and inviting. To improve navigation within these compact areas, color-coded pathways can be introduced, providing an intuitive wayfinding system that guides patients seamlessly through the clinic while adding a lively and engaging element to the design. While incorporating art into the healthcare environment undoubtedly elevates aesthetics and contributes to healing atmosphere, it must not hinder cleaning protocol. Engaging custodial teams during early design phase is vital, as their insights can inform choices that prioritize both beauty and cleanliness. Utilizing removable wall panels allows for both artistic expression and practical maintenance, as they can be easily cleaned or replaced without disrupting the overall design. Additionally, Incorporating digital displays that can be updated regularly can keep the environment feeling fresh and relevant while ensuring that high cleaning standards are maintained. By thoughtfully addressing this concern, we can create healthcare environments that are functional, safe, and foster a sense of comfort and well-being for all who enters. Let's connect this vital concept to financial bottom line. Enhancing navigation within the healthcare facility reduces the hour staff spend on wayfinding and fostering increased patient loyalty through improved experiences. This translates into significant cost saving and potentially high revenue as satisfied patients are more likely to return and recommend your services to others. A notable redesign project at Cleveland Clinic resulted in 40% reduction in patient wayfinding complaints. This improvement directly correlated with substantial boost in patient satisfaction scores, emphasizing the financial viability of investing in thoughtful design. Cultivating a calm and stress reducing environment allows your facility to differentiate itself in an increasingly competitive healthcare landscape. An inviting atmosphere can enhance your institution reputation, attracting more patients and thus increasing market share. Thoughtfully designed environments significantly impact healthcare professionals' well-being, contributing to lower burnout rates. Research indicates a strong connection between exposure to natural light and a 30% reduction in nurse turnover, directly influencing hiring costs and staff continuity. Well organized and obstruct corridors are vital for prompt response times during medical emergencies, which can be pivotal in patient outcomes. Quick access to critical areas and resources improve overall workflow and enhance team performance. Incorporating safety features such as strategically placed handrails and slip-resistant flooring is crucial. These design elements lower the risk of falls and significantly mitigate legal liability, ensuring a safer environment for patients and staff. As a designer, your design work extends far beyond aesthetics. It has a profound impact on patients' recovery and clinician efficiency. By adhering to evidence-based design principles, you play a pivotal role in shaping spaces that promote healing and well-being. It is essential to consider how each design decision influences the overall environment and its occupant. Corridors are not mere pathways, they are lifeline of healthcare facilities. When thoughtfully designed, they can convey messages of hope, dignity, and operational efficiency. Investors should recognize these elements as pivotal investments in human-centered care that promise long-term benefits to the institution and its patients. Designers should understand that you are both architect and healer, shaping environments that promote well-being and recovery. To all our listeners, let us aspire to create healthcare settings that transcend traditional medical care. Let's embrace the mission of nurturing the body and soul. Thank you for tuning in today. Until next time, remember to design with care.